Good day everyone, welcome to our rationalization for Nloa 2 long test 4, and I'm actually in charge of discussing F1, F2, and F3, and this is focused on nursing practice 5, which is professional adjustment, leadership and management, ethics and research. Let's begin with question number 1. A physician writes a stat order for an unusual high dose of medication. Nurse T questions the physician, who reassures her that he does is correct. Nurse T asks a colleague, who also agrees that the other seems acceptable. Despite an underlying professional uncertainty, Nurse T administers the medication and the client suffers irreversible harm due to an overdose based on the legal principles outlined in the sources. What principle best explains why Nurse T will be held liable alongside the physician? A. The doctrine of force majeure does not apply to clinical errors. B. Nurse T committed a sin of commission by administering the drug. Letter C. The nurse is responsible for her own negligent act, which include failing to challenge a questionable order, thus breaching the standard of care. Or letter D. The doctrine of res superior makes a physician solely liable for the initial incorrect order. The correct answer here is letter D, because this mirrors a case where a nurse questioned a dose but administered it anyway, resulting to possible death, which leads to both the physician and the nurse who give the medication being held liable. And of course, we know that the state is that the nurse is responsible for her own negligent act, while failure to allow physician's order is negligent conduct, or critically failure to challenge a physician's order is also specifically identified as negligent conduct. And by administering the drug she questioned, Nurse T breached the standard of care, which defined as a degree of judgment and skill in nursing care given by a reasonable and prudent professional nurse under similar circumstances. Correct answer, C. Number 2. A client's family member is distraught about learning the relative has terminal illness. Nurse J attempts to comfort the family member by sharing specific sensitive details about the client's treatment and prognosis in the hospital's hallway, where other staff and visitors can hear the conversation. Nurse J's action, though attempting to be compassionate, primarily violates which core patient right according to the sources? The correct answer is letter B, the patient's right to privacy due to undue disclosure. Letter A is wrong, beneficence is wrong, and the right to fidelity is also wrong. So we know that if there is an undue disclosure, it's considered to be a breach of the client's right to privacy. Even if the information is shared with a family member, disclosing it in public space like the hallway is a violation of the client's standard of confidentiality. And the patient's record is covered by this what you call privileged communication. And furthermore, discussing a resident by name in the cafeteria is specifically cited as breach of confidentiality. Number 3. Nurse P, working in the pediatric unit, turns momentarily away from a 2-month-old infant she's weighing to retrieve an item she forgot. During this moment, the baby rose off the scale and sustains a skull fracture. For the client's family to successfully sue Nurse P for malpractice, what combination of elements must they be able to provide based on the requirements listed in the sources? 1. Error, lack of concern, battery. B. Misrepresentation, negligence, and information. C. Injury, error, and assault. Or D. Proximal cause, negligence, and nurse error. The correct answer here is letter D, because it describes professional error resulting in injury. And when a patient sues for malpractice, the patient must be able to prove proximal cause, presence of negligence, and nurse error. And we know that negligence is a failure to do something that a reasonable person would actually do. 3. Delta. 4. A mentally ill client in a long-term care facility is currently on a general diet order, requests only a vegetarian meal for dinner, citing deeply held personal belief, which nursing intervention best demonstrates the principle of autonomy in the situation. Tell the client what a vegetarian meal cannot substitute for a general diet. Contact the client's family and obtain their consent to provide a vegetarian meat to the client. If necessary, obtain an order from the physician for a vegetarian meal. Otherwise, provide a vegetarian meal per client's request. and contact the client's medical power of attorney for permission to make a change of diet. The correct answer here is letter C, because we know that autonomy involves respecting the client's right to self-determination, and the best principle of autonomy is for us to make sure that we are going to obtain order from the physician for a vegetarian meal, and otherwise provide a vegetarian meal per client's request, because this shows respect to the client's wishes while acknowledging the client's or the requirements for a physician's order regarding the client's diet. Answer, Delta. 5. Nurse C signed a 2-year employment contract with a local government hospital. After 6 months, she learns that the contract terms violates a newly passed local labor ordinance. Based on the provided information regarding contracts, which factor is a valid ground for Nurse C to legally break her contract? A. The contract was unwritten. B. The contract requires her to work more than 40 hours per week. Letter C. The contract involves an unwritten term substituted with another contract, or the contract is unlawful substituted with another contract and contrary to public safety. The correct answer here is letter D. The grounds that could be used for breaking the contract includes conditions that are unlawful, substituted with another contract, contrary to public safety. Letter A, letter C, there are unwritten terms, so that's wrong. And letter B, 40 hours per week is the normal, and more than 40 weeks is not already normal. 5D. 6. A nurse is caring for a client with a progressive illness who asks the nurse to keep the diagnosis secret from the immediate family until after a major family event scheduled for the following week to prevent disruption and sadness. Which action by the nurse is best supported by the ethical theory of utilitarianism? The nurse tells the client that to-telling is an ethical rule that nurses must uphold and requires the client to inform the family. The nurse tells the client's spouse about the disease progression in secret, hoping the client would gently introduce the information later. Or the nurse does as the client wishes and keeps the diagnosis from the family until after the wedding, minimizing pain and maximizing the happiness of the majority for the short term. Or letter D, the nurse insists in telling the family members immediately, as preserving life is the ultimate good. Of course, we know that utilitarianism is an ethical act which minimizes pain and suffering and maximizes pleasure and seeks happiness of the majority. In this scenario, the act supported by utilitarianism was doing as the client wishes and keeps the client's diagnosis from the family until after the wedding. 6. Answer, Charlie. 7. A patient in the waiting area asks the nurse for her opinion regarding a specific doctor's competency. The nurse loudly replies that the doctor is rude and incompetent and suggests the patient seek another physician. For which charge can the nurse be held liable in this specific situation? A. Libel. B. Assault. C. Breach of privileged communication, or D. Slander. Of course, we know that if the nurse comments that the doctor is rude and incompetent, the nurse can be held liable for slander, or that is what you call verbal defamation, as opposed to libel, which is libel is actually written. Correct answer is Delta. 8. While assisting a client who's recently had restraints discontinued, the client climbs over the side rails and falls to the floor. The nurse immediately begins assessing the client and then prepares the required unusual occurrence report, which statement accurately describes the function and appropriate content of the incident report according to the sources. A. Is it legal part of the chart used to furnish data about the incident? The nurse should note the name of the nurse who was responsible for monitoring the restraints. It's the hospital record used to record the details of the incident for possible legal reference, noting the facts of the incident as it happened, or it is a legal hospital business record which is subject to subpoena and can be used against the hospital personnel. The answer here is letter C. And when filing out the report, the nurse should note the facts of the incident as it happened, and the incident report is specifically noted as a record separate from that chart. 8. Charlie. 9. Mr. Z, a sane person with no medical credential, rents a clinic space and begins telling neighbors that he is a certified physician and registered nurse offering fake treatment plans in exchange for money. What offense Mr. Z will be held liable? Answer is letter D, misdemeanor. If a non-medical sane person convinces others that he is a nurse or a doctor, he may be held liable for misdemeanor. That is letter D. Number 10. During our severe flu season, a nurse is responsible for administering a limited order for flu vaccine. She decides to prioritize vaccine for older clients and those who are immunocompromised over young, healthy staff members. Which ethical principle is best demonstrated by the nurse's decision regarding the distribution of the vaccine? And the answer is justice. So, the scarce amount of flu vaccine will actually be given to the most needy, because when we say it's justice, there is fairness in distribution of resources. 10 delta. 11. Nurse A provides a steam inhalation treatment for a client. Use equipment that appears functional but is unknown to nurse A. Defective. After a treatment, the client suffers burns to the face due to faulty equipment. In the event that the client sues, who among the following parties can be held liable in court for the resulting injury? That is the hospital and the nurse, because of the doctrine of respondeat superior. And the nurse could possibly be charged with reckless imprudence for the act of administering the treatment with a defective equipment, while the hospital is liable under the ownership and maintenance duties. That's letter D. 12. A nurse is caring for a terminally ill client receiving a palliative care at home. The nurse discovers the client is routinely taking extra doses of prescribed medication that could accelerate death. The nurse is aware of this behavior but decides not to intervene or report the over-medication. According to the definitions provided in the sources, which action describes an act of euthanasia? Correct answer is delta. So, that's actually an action that would be considered as an act of euthanasia. This is an act of omission to facilitate the client's death, and the other option is basically appropriate for end-of-life care decisions. 12. Answer delta. Let's proceed now to F2. Nurse Carla is caring for a client experiencing sudden severe anxiety and hyperventilation. The physician has no left specific orders for managing anxiety attacks. Nurse Carla immediately applies guided emergency techniques and begins coaching the patient through controlled breathing exercises, successfully de-escalating the episode. Professional coordinator sources permits Nurse Carla to initiate therapeutic actions such as guided imagery even without a direct physician's order. Of course, we know that is autonomy, in which that is focused on the ability of the nurse to initiate actions even in the absence of a physician's order, and that is the nursing process, which expands critical thinking and decision-making skills, allows the nurse to determine the appropriate independent intervention for the clients or for the physician's constantly changing health status. 13 delta. 14. Mr. Reyes is admitted to the medical floor. His chart prominently displays an allergy alert for medicine or penicillin. Documented upon admission, Nurse J, busy with a new admission, glances quickly at the chart and administers an ordered antibiotic, forgetting to check the drug class. The antibiotic turns out to be a form of penicillin. Mr. Reyes suffered a cerebral damage resulting from an allergic reaction. This action by Nurse J, leading to documented harm despite clear contradictions in the record, is a classic example of legal offense, and that is letter C, malpractice, because she administered a drug against documented allergy causing serious harm. So the answer for number 14 is letter C. 15. Nurse Dan realizes he mistakenly administered 10 units of regular insulin instead of the ordered 5 units to a non-diabetic patient. He immediately monitors the patient's blood sugar, notifies the physician, and completes an incident report documenting all steps taken by promptly notifying the client's doctor, and meticulously documenting the error through an incident report, a nurse Dan is primarily demonstrating which professional attribute, and that is accountability. So that's notifying the client's doctor and writing an incident report after making this mistake in giving medication is the explicit description of accountability. And accountability is also one of the required characteristic of a professional nurse. 16. Nurse Eva is performing hourly rounds on her patients. She notices that Mr. Lee, who was joking with his wife 30 minutes ago, is now pale, diaphoretic, and complaining of severe chest pain. Nurse Eva immediately initiates emergency protocols and notifies the cardiac team. Nurse Eva's quick recognition and timely response to Mr. Lee's sudden decline best supports which core concept of the nature of nursing, and that is nursing is dynamic. And of course, the concept of dynamic nursing states that the health status of every patient is constantly changing, and the nurse must be cognizant and responsive to these changes. And Nurse Eva's actions directly align with being cognizant and responsive to the client's rapidly changing status. 17. Nurse Anders is preparing to take the licensure examination. He understands the primary purpose of requiring licensure registration for all practicing nurses in the Philippines is to ensure professional competence, which, while ensuring competence is an effect, what is the primary purpose and criteria for nursing licensure according to the sources? Define the scope of practice, limits practice, outline legislative action, or protect the public. The answer here is protect the public. And that's basically the purpose of licensure examination. And this licensure examination and registration is basically the mechanism that warrants that only competent nurses are allowed to practice nursing in the country. 17. Delta. 18. Mr. D, a 40-year-old patient, is about to undergo a hysterectomy. Before Miss D signs a surgical consent form, the nurse ensures that the patient has received due explanations about procedure and confirms the patient is of sound mind. Then confirming the patient is an adult and has received explanation what final requirement must be met for the informed consent to be considered legally valid. Signed by 2 witnesses, signed by the patient and the next of kin, signed by the consulting adult and signed by the witness, and signed by the patient and reviewed by the hospital lawyer. The answer here is Charlie. It should be signed by the patient. And it should be with a witness, and that is basically the nurse. 19. An elderly patient with limited mobility received a hot compress application from a nurse to treat localized muscle pain. 30 minutes later, the nurse returned and found that the patient had developed severe blistering on the skin under the compress, suggesting a burn. The patient insisted they did not move or adjust the compress, since the injury occurred under circumstances that would not ordinarily happen without negligence, and the object was under the client's or the nurse's exclusive control. This incident illustrates Swiss legal doctrine, and that is res ipsa loquitur, or the thing speaks for itself. That's letter D. 20. Nurse Kim receives a written order for ketorolac 30 mg IV stat for a patient experiencing acute pain. The physician is no longer in the hospital. Nurse Kim checked the order, prepares the medication, and administers it correctly. With Nurse Kim administer medication in physician's absence, under which condition is she legally protected? Answer, letter C. Nurses are legally protected when carrying out the doctor's order in the absence of the physician. Letter E, of course, there's no need for a witness of the physician. And the responsible superior includes the physician. Letter D, never legally protected. Of course, we are protected. 20, the best answer is Charlie. 21, Nurse Rita instructed an unlicensed nursing aide to retrieve an IV bag of Normasaline from the supply room. Instead, the aide, attempting to be helpful, hooked up the 5LR solution, which was the supply basket. The patient suffered severe fluid shifts since the nursing aide performed a harmful and wrongful act, hooking up an IV that was outside the scope of their legitimate function. The aide is most likely liable for which offense, and that is malfeasance. We know that malfeasance is actually creating an error because you are going beyond your scope. Misrepresentation is when you're acting as if you're a nurse. Negligence, there's actually going beyond, which is also part of the malpractice. Answer here is alpha. A group of nursing students is discussing the administrative bodies that oversee nursing education practice. They understand that the PRBON handles most regulatory aspect. Which of the following actions is definitively not included in the functions of the Board of Nursing as listed in the sources? Study conditions of nursing practice, set the scope of licensure examination, issue, suspend, or revoke, or open or close. The answer is D, because that's a function of the Commission on Higher Education. 22, the answer is D. 23. A co-nurse confesses privately to you that she administered a wrong dose of a medication to a patient 30 minutes ago, but the patient currently appears stable. The co-nurse is nervous and asks you not to tell anyone yet, which action reflects the nurse's highest ethical and professional obligation in this situation. The answer is D. Accompany her to the head nurse to report the incident. So this supports what we call conduct and accountability. You should not be the one reporting, but it should be the two of you. 23, the correct answer is delta. 24. A patient requests that the nurse withhold information about their terminal cancer prognosis from the patient's family until after their daughter's destination wedding next week. I think it was actually repeated. The answer here is letter B, utilitarianism, that is focused on pleasure. That's one thing that will maximize happiness before the wedding and best demonstrates this principle. Deontology is duty. Divine command theory is basically the divine law and virtue ethics that pertains to your moral. 25. A patient's medical record chart has been subpoenaed for malpractice hearing. The nurse in charge of the documentation concerned about the legal ramifications of the detailed notes recorded regarding the legal status and management of the patient's chart. What guidance must the nurse adhere to? The answer is delta. The hospital owns the record, and although covered by privileged communication, it may be disregarded upon the death or revocation by the patient. 25, delta. Let's now have F3. Yuri is a new graduate of Bachelor of Science in Nursing and intends to practice his profession in the country upon acquiring his professional license. He understands that the power and duty to regulate the practice of nursing in the Philippines is vested in what agency? And that is letter B, Board of Nursing. PNA is the APO, Technical Committee on Nursing Education, that is in that shed, and ANSAP is for Nursing Service Administrators. Answer, bravo. 27. His friend Yaru failed to pass the examination for 3 consecutive attempts. Which of the following actions can he take? Take the examination for the fourth time, enroll in a refresher course, shift on a mother profession that suits his level of competence, or apply as a nursing assistant in a hospital. Of course, in our current nursing law, there has no limits of the board exam, so you can take it anytime, or you can take it unlimitedly. The answer, alpha. You have to take the examination for the fourth time. No need for refresher because that's not mandatory in RE 9173. 28. Yuri is certain that he can be legally liable if he commits which of the following? Appends RN to his name even without being registered as one. Abets or assists Dr. Wang in offering chest physiotherapy without the approval of the BON. Uses the registration of number of Patrick as his own, or none of the above. In this case, the correct answer is letter A, because you're not registered, therefore you should not use it. And letter B kasi, chest physiotherapy can be done independently, so therefore there's no need for approval by the BON. And uses the registration number of Patrick as his own, it was not been mentioned that the registration is basically a nursing registration. So then 8 is alpha. 29. On a long-term basis, he dreams of becoming a director of nursing someday, which is the following he does not need to possess in order to qualify for the position. Pass the written comprehensive examination for the master's degree, 5 years of experience, master's degree holder, member of a good standing, or be a registered nurse in the Philippines. The answer here is A. because of course you need to be a master's degree holder. It doesn't only mean that you need to have a comprehensive exam. 29 is letter A. 30. After 2 years in the hospital nursing, Yuri decides to change a career to military nursing. He knows that the chief nurse in the military nursing is not yet qualified if he does not have master's degree, general staff course, at least 9 units, or master's degree in nursing and general staff course. Of course, one of the most important requirements if you would enter the military is for you to have a training, and that is from a general course. 30, the best answer is Bravo. Yuri's cousin Yan has just graduated from college with a degree of Bachelor of Science in Nursing from a recognized college of nursing. He intends to take the intended comprehensive nurse licensure examination so he can practice his profession after passing the said exam. Which of the following statement is not needed by Yan to qualify for the said examination? Holder of bachelor's degree, must be good moral character, citizen of the Philippines, member of an accredited professional organization. The answer here is D. Because you're not yet professional nurse, therefore you don't need to be a member of the APO. ABC is the minimum requirements of taking the board examination for nursing. 31 is letter D. 32. Should he fail in one of the subject but obtain the general required general average, which of the following should he do? Take the examination of the subject where he's rated below the required passing rate, makes an appeal for the board of nursing, or enroll in a refresher course. Answer: you need to take the examination of the subject where they're rated below, but you need to have 75% of that. No, not anymore 60. So the advice is take the overall. 32, answer Bravo. 33, upon passing the license examination, which of the following is priority action for Kevin? Of course, after passing, mag-register, and then after that registration, you need to take an oath. Letter B is wrong because that is involved in PNA. You can apply for registration with PRC and prepare credentials for job hunting. That will happen after the oath taking. You need to take an oath first. 33, the correct answer is Alpha. 34. Two of the following statements are true about the new nursing law. Which two are not? The correct answer here is 1 and 3. It guarantees the delivery of quality basic service through an adequate nursing personal system throughout the country, and requires the chairman of the board to be holder of doctorate degree, because the requirement is just man. 1 and 3 only. 35, Republic Act number 764, also known as the Philippine Nurse Act of 1901, is a significant legislation that repealed an earlier nursing law. Which law did it specifically repeal? That is RA 877. After RA 1764 is RA 9173. Then RA 1080, that is regarding exemption of those who are passers of the board from taking the civil service exam. Answer is letter C. 36. The evolution of RA 877 to RA 7164 marked a significant shift in the philosophy of nursing regulation in the Philippines. What best describes this shift? The correct answer is letter A. From focus on nursing basic registration to a more comprehensive framework emphasizing professional development. Kaning letter B, from a decentralized system of regulation to a highly centralized. That's wrong. From a requiring baccalaureate degree to allowing vocation, there's no vocation. From an emphasis on hospital-based practice to an exclusive focus on community health nursing. That is not. 36 is letter A. Under which law was the Nurse Bill of Rights explicitly established, providing a legal mandate for the welfare and protection of Filipino nurses, particularly in their working conditions, and that is in the Philippine Nursing Act of 1921, which is RA 7164. That is letter C. And that is it. Thank you so much, everyone, for listening.